Good afternoon. My name is Natasha Hastings. I'm a public health master's student at SGU, and this is my CILE presentation. My advisor is Dr. Martin Ford, and the topic of my presentation is I wanted to identify the potential in an upstream approach when considering the intervention against neglected tropical diseases. And I did this as a narrative review. On this slide, we can see the competencies that I tried to meet with my project, foundational as well as track competencies. I'm going to let you read them on your own time. I wanted to introduce my topic. So the fact that I'm looking at trying to identify an upstream approach to management of neglected tropical diseases. What's an upstream approach? I find this to be something that's more of like a root cause analysis, where you're looking at the factors that might be propagating an issue rather than what issue is being caused. So in terms of neglected tropical diseases, how are these being enabled in ways that we can attack those things instead of attacking the fact that it's already happened and treating it? I mean, obviously those are very important things as well, but getting to the root of the issue so that they don't even occur. Neglected tropical diseases, I'm going to refer to them as NTDs. They affect the quote-unquote bottom billion of the world. These are the least fortunate people in the world. They have the lowest socioeconomic status, the lowest amount of resources, the lowest amount of education, the lowest amount of professionals. They're just struggling. They have bad sanitary conditions. All of these things are kind of what propagate the spread of these diseases too. The severity at which these people are affected is dramatically underestimated. If they don't have resources, they don't have proper surveillance. They won't know how many people are actually affected. They won't be able to contact trace. They won't be able to get the right amount of treatments, let alone administer treatments to people if they don't even know that they're ill. So I find that this huge issue, we need to just address it in a way that helps any community apply a new method that is cheaper, more cost efficient, and more accurate in terms of identifying cases and treating disease. So my true research question surrounds how we can redefine our approach to NTD control in a way that's feasible, efficient, and will actually reach these populations. So I'm just going to kind of brief over my methods because there's a table on the next page that's a bit more in depth, and you can take your own time to look through that and understand this a little bit more. But I ended up selecting 23 articles from 3 different databases: PubMed Central, NCBI, and PLOS Medicine. Overall, I found almost 5,200 articles. I ended up selecting those 23. Some of my inclusion criteria was that the papers were written in English, that they were published between the year 2010 and 2024, as well as mesh terms that I used. These were neglected tropical disease burden and prevention. I put a lot of emphasis on clinical trials to get actual results and outcomes, as well as literature that surrounds neglected tropical diseases. I wanted to kind of identify what's already happened, the collaborative efforts that have gotten us to where we are, as well as what's been tried, what's been successful, and what's failed. On this slide is that Prisma flowchart we were just talking about. You can see from the beginning my entire process of identification, screening, and selection. I started with a lot of documents, and the majority of them I could not freely access publicly, so I ended up with the 23. The results and findings of my narrative review were that Africa, Asia, and the Americas are the most affected by neglected tropical diseases. I think we're all most familiar with Africa being a public health crisis issue, and because of that, they've received the most funding, the most resources, and the most help. Because of that, I used Africa's clinical trials as their clinical trials in treating malaria as kind of reference points for how we could apply similar concepts to neglected tropical diseases. These trials were successful in advancing diagnostic testing, streamlining treatment. Another big thing to do with like calculating how this happened was a factor called disability adjusted life years. These are referred to as dailies. So these are the amount of years in your life that are adjusted due to a disability. And so many disabilities come from dengue, hemorrhagic fever, leprosy, and these things could be prevented with preventative prophylaxis. So there was a clinical trial in Africa that was done with preventative prophylaxis in intermittent periods for school-age children when treating malaria, and they were successful in reducing the overall amount of dailies that were responsible to this disease. It was also a key thing to recognize in Asia, for the most part, that local figureheads and leaders and teachers alike, they're all extremely important in community and cultural awareness as to how to treat disease, how to manage your health, and what's trustworthy and what's not. There's a lot of distrust in Western medicine that these figures can truly help with. In order for their programs, like for the programs that we're trying to instill to eliminate these diseases, in order for them to be the most successful, they have to be culturally appropriate. Otherwise, it's just not going to reach the communities. I have my results in some pictures on this table for you. You can see the geographical distribution of the burden of disease on your left. You got the Americas to your very left. In the middle, you have Africa. To the right of that, you've got Asia. There's a table on your right that shows you those disability adjusted life years from 2010 and 2015 with the implementation of preventative prophylaxis. Noteworthy clinical trials that I found or stumbled upon was a cluster randomized trial evaluating implementation, the effectiveness of that intermittent preventative treatment for malaria. This occurred in Tanzania, Africa. They targeted school-age children because that is the most effective way of reducing overall dailies, because there's a linear relationship that showed between infection rates and age. So the younger this illness could be prevented, the more healthy years of life you would have. Another noteworthy trial, there was a trial in Kenya where they measured S. Masoni's force of infection through antibody response to stool antigens. So in doing this, they took their testing from needing to collect stool to needing to collect just drops of blood, and being able to have those respond with antibodies and define the extent of disease. And this was a lot easier. It was way more applicable in a wider setting, and it was just more cost efficient. So just ideas like this are kind of the direction that I'm hoping we can steer into to find more methods that would reduce the issue of these neglected tropical diseases in a way that is affordable. So I elucidated on programs that have been successful in combating the neglected tropical diseases. They usually all embody collaborative efforts, usually various stakeholders. Almost always the WHO, the World Health Organization, is a key player in these. We don't only have to understand how many people are affected by this, but we also have to know how to properly reach populations for them to be able to hear our message, understand our message, and be able to make the right decisions for their own health. Another major thing, I think it's imperative that current protocols are re-examined for how true they are and how cost-effective they can be. The test that was identified with the antibodies is much more accurate than the stool antigens, and I think we could find that with a lot of current measures. I want to recommend further research on cost-efficient integrative vector management, safer and easier to use medications, increasing awareness of cultural values and practices in terms of project design. I also advocate for early intervention and treatment in terms of maximizing clinical outcomes, and I place emphasis on the use of evidence-based medicine for increasing the efficacy and informing public health policies and regulations going forward.